One of the unique things about Zusman Hospice is that as an organization, they chose to invest in a full-time hospice medical director. And I'm very proud to have that role. Being a small hospice, we are able to really tailor the care to the needs of an individual patient and their family. Whether that is a stronger focus on faith, whether it is needs that are social or economic needs, whether they are medical needs. One of the things that makes us so special is that we know each other's patients and that we are all aware of patients and their families and the needs that they have. People are fearful that they are going to die because they've accepted hospice services. So the association in their mind is that because they've come on hospice, they will die. The reality, or the other way to look at it, and this is how we try to encourage patients and families and even referring clinicians to view this, is you are referred to hospice. You come to hospice because you are dying. Hospice doesn't bring about your death. Hospice helps you through the process, helps you live up until the moment that you die. When you are in a position of privilege and you have an occupation that is respected and you have this opportunity to influence and change someone's life experience, and in the hospice world you have the opportunity to change their death experience, you have to be mindful of that, and what you say and what you do at this moment will last for them forever. What you give them when you are honest with them is a couple of things. You give them the opportunity to plan. They can still hope for the best. They can still pray for healing. They can still, as a family, hope that they will get well. They can hope for a miracle. But you also allow them to plan for what you, as the healthcare provider, know is the most likely reality. Miracles do happen, but in my thoughts at least, God doesn't need feeding tubes or ventilators. If you are to get better, you will get better. If I deny you the opportunity to plan for your death, then I deny you the opportunity to say goodbye. I deny your family the opportunity to say goodbye to you, as well as the more practical things. How do we plan for a funeral? How do we do the legal paperwork? How do we plan for a child who we're going to be leaving behind? People have a lot of fears as they go through the dying process, and some people fear death itself. There's sort of two aspects to that. Some people fear what happens spiritually and emotionally, and where do we go from here? And to that, I will say, I don't know the answer to that, but let us have that as a conversation. Let me bring in the members of our team who can help talk about that. None of us know, but certainly that's a valid fear and one that we should address and talk about. But the other thing that people fear about death is the actual dying experience. Am I going to feel short of breath? Am I going to feel like I'm drowning? Am I going to have crushing pain? Is there going to be gasping? All we know about death really is what we see on TV. What the hospice nurses and I can help people understand is that we can take care of the physical symptoms. That's the easiest part of all of this, is caring for the physical symptoms. We can explain up front what the dying process looks like, so that as these changes happen in your loved one, you know what you're seeing. Changes in breathing patterns, changes in the temperature or the color of their skin on their hands and their feet. And most importantly, we can help patients and families understand that dying doesn't have to be painful. There are many medications, many ways that we can support someone through the physical changes that happen as you're dying. Death can be comfortable, and it should be comfortable. It's one of the things that hospice offers. If you want to die in an ICU, if you want to die while pursuing aggressive medical treatments, I think that is your right to choose that. But most individuals, when asked, either as they're going through the process or years before, or in retrospect, when you ask a family member, most people, they don't want to die in a hospital. Most people do not want to die in a hospital gown with tubes and wires. They want to die surrounded by their family in a place that's comfortable, and they want to die with dignity. They want to die comfortable, and they want it to be peaceful. They want to be surrounded by love. For some people that means home. For some people it just means not the hospital. At Zusman, we've been very blessed by Larry and Leonore Zusman, who gave a substantial contribution to allow us to build Zusman House, which is a phenomenal facility. And I think that all the patients and families who've spent time there would agree that it's just a really unique place to be. It's a nice option when home doesn't quite work at this moment to have Zusman House to come to. But it is more than just the Zusman family. Every individual who makes a contribution to Zusman Hospice helps us provide care for other patients. We do have patients who have absolutely no insurance, do not have Medicaid, do not have Medicare, and we're able to take care of them by virtue of contributions that we have. But it is also a way to honor your loved one, and when people pass away, it's an opportunity to say, this was a very special part of my loved one's life and of our family's life. And so donations made to this facility, to hospice, in memory of our loved one is, I think, an amazing tribute to a loved one who has passed away. The goal in hospice really is to help people live, to live as fully as they can for as long as they have. Hospice is not here to shorten our time, but we are accepting of the idea that medical technology can no longer prolong our time. Hospice is about living. Hospice is about living now, and it's a good reminder for all of us that now is really the only time that we know we have for sure.